All right, Dr. Gill, now for the million-dollar question. How does someone actually get periodontal disease?
Periodontal disease is bacterial in origin. One of the key factors is poor oral hygiene, or it's sometimes genetic, smoking, diet, stress, hormonal changes. There are many factors that cause periodontal disease, and it's generally a combination of a lot of factors, not just one reason. So basically, the plaque that is formed on the teeth, it harbors bacteria, and they cause inflammation of the gums, which eventually translates into bone loss.
Are there steps people can take early on to prevent periodontal disease?
Yes, it's absolutely imperative that you see your dentist every 6 months. Let the hygienist probe those teeth, and anytime you hear a pocket of 4 or 5 millimeters, be proactive. Sometimes you need deep cleaning. Sometimes all you need is better oral hygiene, regular flossing, mouth rinses, and you can control the disease before it progresses any further.
Lasers sound high-tech. How effective are they in treating gum disease?
Lasers are extremely effective if you catch gum disease when it's mild to moderate. We have always said that you cannot treat gum disease, you can only control it. In other words, you cannot cure, you can only control. But with lasers, what I have seen in my practice is if we diagnose periodontal disease early on, we are able to absolutely cure it, and I can say it with confidence. When periodontal disease is advanced, we can control it with lasers, but we cannot cure it.
All right, Dr. Gill, what is the LANAP protocol?
LANAP is acronym for Laser Assisted New Attachment Procedure. Essentially, we use a laser to separate the gum from the tissue and the tooth, and we are able to clean under the gums. We are able to smoothen the bone, and then we use a laser pulse to achieve homeostasis. In a simple way, we are able to treat gum disease without cutting the gum, without any stitches, and without any downtime. It's a completely non-invasive process, and we have seen regeneration of connective tissue and bone in 95% of the cases. Many patients would not accept periodontal treatment because they were scared of the gum surgery. And as you know, the gum surgery, they cut open the gum and then they're going to, smoothen the bone, clean it out, and then stitch it back up and send you home with a perio pack. And it would hurt, and it would hurt for weeks. And so the patient acceptance was not there. And then I would see on my watch patients going from a periodontal pocket of 6 millimeter to 9 millimeter, and at some point losing their teeth, and then going into these expensive dental implants. All of that could be avoided if we are able to do LANAP procedure on these patients and save their own teeth. That way they don't have to go into those expensive surgeries. And most patients don't realize that even dental implants can get periodontal disease. We call it peri-implantitis. Even there, we have a LAPIP protocol that helps us significantly to reduce the inflammation around the gums. So in our practice, we've noticed that it has been of amazing help when we explain to patients what is LANAP, and the acceptance is through the roof, and the results are, like I said, unbelievable.
It sounds like such a key advanced treatment, and also one that's a lot less painful.
Yes, and it's been around for 20 years. It's not a new treatment. It's been FDA approved, and there is research. So it's not experimental at all, like some clinicians make you believe. It is something that is reproducible. It's a medical procedure. It's not poetry.
What can a patient expect right after LANAP treatment?
Some soreness, and they have to follow instructions, baby food, for at least 8 to 10 days. They cannot brush that area. Essentially, you don't want to disturb the area which is healing. Just like when you get a tooth extraction, you have a blood clot, you don't want to disturb it because that's where the healing starts. Another thing is you cannot floss, and no spicy food, nothing too hot. And after 6 to 7 days, you can go back and resume your normal life.
Are treatment outcomes consistent across patients, or does it really depend on the case?
Treatment options are very consistent when you catch the disease when it's mild to moderate. When the disease is advanced, at that point, it is not very predictable. We have seen good results, We can take a 10 millimeter pocket to a 7 millimeter, but we cannot take a 10 millimeter pocket to 4 millimeter without some sort of connective tissue surgery. So yes, to answer your question, the outcomes are very predictable.
Facial aesthetics in dentistry is a hot topic. Tell us about smooth lays and how it works.
Facial aesthetics is a fairly new branch of dentistry. The logic is that the mucosa, the oral mucosa, absorbs laser energy better than the skin. So the procedure is done intraorally. We have state-of-the-art light walker. So it's again an erbium laser and an NDA-YAG laser. So first we do collagen heating, and then we go in with the erbium laser from inside the mouth, and it essentially tightens up your skin, takes away the wrinkles under the eyes, the double chin, and it's a natural way. It's like a laser facelift. There are no fillers, there's no surgery, and that's why we call it smooth lays.
Wow, fascinating.
Yeah.
Sleep apnea affects so many people. How are dentists helping, and what is night lays treatment?
Sleep apnea is very prevalent among our population. We always work with the primary care physician of the patient. There's a sleep study, and dentists on their part can make sleep appliances for the patients, which helps move the jaw forward and opens up the airway. Night lays is more of a snoring treatment, where we go in with an erbium laser and we tighten up the mucosal membrane around your airways and essentially making the airway bigger. And that takes away the snoring. So we have had high success rate with night lays procedure.
How important is occlusion in dental work, and what does it mean for long-term results?
Occlusion is everything in dentistry. If patient is not biting correctly, if the occlusion is off, nothing is going to work, be it a crown, be it a filling, be it full arch protocol, nothing works. Occlusion is the most overlooked and important part of dentistry. And that's why when patients come into a practice, we do wellness scans and then we check their occlusion. These days, thanks to digital dentistry, we have so many options. And the first thing I do for any patient that walks into my practice is check their occlusion and fix it.
And finally, Dr. Gill, dry mouth seems super common. Why does it happen, and how can it affect our teeth over time?
Dry mouth is generally caused by medications, like blood pressure medication, antidepressants. And generally we work with the PCP of the patient to change those medications to help dry mouth. You can use sugar-free chewing gums or artificial saliva products in the market to alleviate the condition. But I've seen that most patients who have dry mouth are more prone to developing periodontal disease and tooth decay. So it's essentially a multi-pronged approach to correct the situation.
Dr. Gill, this entire segment has been so informative. It's not only going to help people protect their current smiles, but also give them the options that they might need wherever they are in their dental journey. Thank you so much for joining me on Good Day.
Pleasure is all mine. Thank you for having me.